Good afternoon, everyone. I would like to begin this presentation with a question. If you wanted to maximize bone health, meaning that you wanted to do an activity where you get the greatest aggregate of bone density or bone mineral content as you're growing up through adulthood, what might you think the number one activity or sport that you would attempt? And I'm going to ask somebody just to name a sport. Gymnastics. Jump rope. Okay. So the answers for the activity that would yield the greatest aggregate or accretion of bone mineral content, greatest bone mineral density, was gymnastics and or jump roping. Probably gymnastics is the one that is most commonly rated the greatest activity for promoting bone health, especially in the formative years, for especially young girls, but also for boys. As you know, early in life, the majority of your bone mineral content is being developed. On a continuum of right near gymnastics, about in the middle, or on the lower side of sport or physical activity, where might youth swimming be found? The traditional lap swimming age group competition. Really close to gymnastics? Okay. Really close? How about somewhere in the medium range of sport? Or maybe somewhat on the lower range? What's remarkable in evaluating the research literature, youth sport does not yield for age group swimming very high bone mineral contents and very high bone mineral densities. And that might be due to one very important factor that minimizes the second important factor with exercise regarding any of the health systems of the body. When youth swim, they have very active skeletal muscles in their arms, and based on the stroke, their legs as well. Yet, they have absolutely, generally no weight bearing. They're totally floating when they do their activities. So they're losing a weight-bearing component, usually given for all these other sports and activities that would help to promote and maximize bone growth and accretion. So I'm not here to say what is the magic elixir to prevent this less than ideal accretion of bone mineral content and bone mineral density in our youth, but you can imagine how you can supplement youth age group swimming through resistance exercise, through more weight-bearing strategies of the overall training program, which in fact many swimmers do to this day. And so my first message for this presentation is, as healthy as swimming is perceived to be, it's also a sport where the ability to maximize bone health and bone growth in the formative years must be taken into account. The reason why this continues into adult age is if a child or a young adult does not maximize bone growth, their gradual loss in bone mineral content and bone density, which occurs following their peak time period, will yield to a faster pace towards osteopenia, abnormally low bone mineral density, and hopefully not, but ultimately osteoporosis, where there's a significantly reduced bone mineral density leading to a greater risk of fractures. Now, will swimming throughout middle age and older age help to maintain increased bone mineral content or perhaps have no benefit whatsoever. And so this is a very critical issue that needs to be addressed and also further studied. In many studies in which postmenopausal women or middle-aged women are subjected to aquatic exercise, there's 3 results that can happen in relation to bone mineral density or bone mineral content. 1, bone mineral density and or content continues to fall at the same rate of the sedentary, non-active individual population. That's bad. Second, it could stabilize. So for a period of time, maybe not necessarily increase appreciably, but also not decline as you normally see in the more sedentary population. Let's say that's okay. As you age, your bones aren't aging at the same rate. And then finally, the best case scenario, if the aquatic exercise is rigorous enough, you can actually see an increase in bone mineral density and or bone mineral content. The activities in the water where that is most likely to occur will, as you would expect, include a weight-bearing component, so there's some type of a shallow water type of experience, and there's external resistances applied to the body, where the person is doing resistance exercises against bands, against other forms where the musculature is generating forces acting on the skeletal system at a much greater rate and magnitude as you would see with just traditional swim exercise training and conditioning. And in those types of studies in which those protocols have maintained or even seen small but useful increases in bone mineral content, it's a dual function. You see increased markers of bone formation occurring in the postmenopausal women, but you also see a decrease in blood markers of what's called bone resorption, or taking away of mineral content from bone. And those are the 2 methods that the skeletal system can use to end up with a net effect of an increased or an improved bone mineral density or content. So despite the risk of only performing aquatic exercise at potentially having a less than ideal impact on bone mineral content and density, very small, subtle changes in the aquatic environment can lead to very appreciable maintenance and improvements of bone health as we age. Thank you.